Hi, my name is Jen Lewis, and I'm going to be doing an Integumentary assessment on Katie Lewis. So, Miss Lewis, you've come in for a skin assessment. The purpose of this assessment is to identify systematic diseases that have skin manifestations, such as diabetes, peripheral vascular disease, types of physical abuse, a risk for pressure ulcer formation, risk of skin cancer, and to educate you on the importance of taking care of your skin, your hair, and your nails. Let's start with some questions. Have you recently had any rashes, non-healing lesions, moles, or growths on your skin?
No.
That's good. Have you had any bruising on your skin, hair loss, or nail changes recently?
No.
Awesome. Have you noticed any changes in your skin, hair, or nails? Like, has your hair been drier, your nails been a little bit thinner?
No.
Okay. Do you have a history of skin diseases in your family, such as melanoma, eczema, psoriasis?
No.
Okay. Do you have any peripheral vascular disease or diabetes currently?
No.
Do you have a history of it in your family?
My dad has type 2 diabetes.
Okay. Do you have any allergies or food sensitivities we should know of?
No.
Okay. Have you ever had a severe sunburn?
Yes.
When? And can you describe it to me?
Last week.
Okay.
And no blisters or anything like that, but just severe redness and pain.
And how did you treat that?
With aloe lotion and then also NSAIDs.
Did you wear sunscreen?
I did not.
Okay. It's very important to wear sunscreen, especially when you're out in the sun.
Okay.
Do you normally wear sunscreen when you're out and about?
No.
Okay. Again, to stress the importance of sunscreen, because sunscreen and sunburns, if you don't use sunscreen, can lead to skin cancer.
Okay, I will work on that.
At least SPF 30 or higher, depending on how pale you are and how long you're in the sun.
Okay.
Do you have sun exposure very often?
Not very often.
Okay. Do you wear any kind of SPF?
No.
Okay. We're about to start the physical exam, so for the physical exam, I may touch your skin, your hair, just feel like any kind of moisture levels, and I'll tell you before I do it.
Okay.
Okay. We're going to inspect and palpate your skin. So you
Okay.
mind if I just look at it?
Yeah.
You still look a little red in this hand from your sunburn, and your hand is warm.
I am still kind of burned.
Okay. But it doesn't look like you have any lesions or skin growths or anything. I see you have a tattoo.
I do.
Okay. You have a mole right here.
I do.
Okay. Color changes we've already assessed, and you are a little red from your previous sunburn.
Yes.
You're still putting aloe on that?
Yes.
Okay. We're gonna look for any kinds of cyanosis.
Okay.
So cyanosis is easily found, like you can see it in the mouth, the lips, the mucous membranes, as well as your fingernails, your hands, and your feet. So we're gonna take a look and see if we see any signs of that. Okay.
Okay.
So let me look at your mouth. Okay. Say ah. Ah. Okay. I don't see any signs. Let me see your fingernails. Okay, that one's good. And they're warm. They're not cold. Let me see your feet. Okay, nope, we're still good. So there's none of that noted, okay?
Okay.
That's a good thing. We're going to take a look at your sclera, which is the white part of your eye, to see if you have any yellowing.
Okay.
And look at me. Look up and down. Okay, and none of that's noted. Next, we're going to test the moisture of your skin. We're going to feel it. It shouldn't be dry and flaky, and it shouldn't be excessively oily.
Okay.
So we're looking for a very normal skin texture here. And I don't see any flakes. It's not scaly. It's not super oily. It's not shiny. Mind if I see your leg? I'm going to touch your leg and just make sure. Okay, we're good there. Nope. Okay. So normal skin texture. We're going to want to look under skin folds, such as those in your axilla area, underneath your knees, and the skin folds like on your stomach. And we would do underneath your breast, but this is not a real client, so we're not doing that today. So do you mind if you lift your arm up? Okay. No rashes noted here. Good. No rashes. Good. Do you mind pulling up your... Okay, perfect. Mind if we look under your knees?
No, go ahead.
Okay, and I'm feeling there's no kind of lesions or any formations. Okay. Same on this leg. Perfect. Have you noticed any kind of like irritation on your stomach recently? None of that?
No.
Okay, perfect. We're going to test the temperature of your skin. You're going to want to use the back of your hands, and we're going to feel up your skin and your arms and the back of your neck to ensure it's not cool, because if you're cool on your hands or your feet or your neck, it could indicate to us bad circulation. Okay? So hands, you're good there. Your hands are warm. The back of your neck is warm. And your feet are warm. Do you usually have cold feet and hands?
Yes, I do.
Okay, and do you know what contributes to that?
I have Raynaud's disease.
Okay, which is an indicator of poor blood circulation throughout
Yes.
the body. Okay. We're going to test the turgor of your skin now to test for dehydration. Do you think you drink enough water normally during the day?
I do not.
Okay. Well, we're going to pinch the skin above the clavicle right here. And if it goes straight back to normal, we're okay. But if it doesn't, then it could be that you're dehydrated, okay? So, right here, we're going to pinch. And it did go back to normal, so you're not dehydrated right now, which is a good thing.
Okay.
But you should drink more water throughout the day. We're going to assess for any variety of edema or swelling, making sure to look in your lower extremities, like your ankles and your legs. I know you worked a 12-hour shift today.
Yes.
But I don't see any edema on your feet here or on your legs. Do you mind if I see this one? I'm going to do the same thing.
I wear compression socks.
I see the marks. Do you think they work?
I think they help.
Okay. And I also checked for pitting at the same time. So I put both my hands on your leg, on your leg, and it went right back to normal. So you don't have any edema present. We're going to look for any skin lesions or skin adhesions you may have.
Okay.
And you said you hadn't noticed anything out of the ordinary. I haven't so far seen any. I just wanted to double check and make sure that you didn't have any present. Look at me. Okay. Perfect. Let me see your legs. I don't see any, which is a good sign. There. Oh, you little bird under your kneecaps too.
Yeah.
Okay. I see a little bit of dry skin right here. Or is that a cut?
That's a cut. That's a healing scab.
Okay. Well, let's not pick it and open that up. If a skin lesion were present, we would assess the color, the size, any elevation of the lesion, how many lesions there are, the type of skin lesion feels like, its shape, pattern, and location on your body.
Okay.
But you didn't have any of those present, so that's a good thing. If we assessed an elderly client, we would want to check for places that pressure ulcers can develop. So any like bony prominences, like the ankles are really bad, the coccyx, so we would look there.
Okay.
And if they were at a risk, we would make sure to pad those places appropriately.
Okay.
Next, we're going to assess your hair. So basically, we're going to look at the quantity, the distribution, the color, and the texture. So
Okay.
do you mind?
No, go ahead.
Okay. So I'm going to look at her hair. I'm going to feel her hair. So she seems to have a full head of hair. There's no spots, no balding spots. The color is even. It's brown. I didn't see any flaking or lesions, parasites, or dandruff in your hair, which is always a good thing. You do have a thick hair texture,
Yes.
so that's good. Next, we're going to assess the hair distribution on your arms and legs.
Okay.
So do you mind?
No, go ahead.
So the client doesn't have a lot of hair on her arms at all. And you mind if I see your legs?
Go ahead.
So there's a little bit of hair on her legs, but not a lot. And it all seems to be evenly distributed. There's no areas that are like not growing any hair. The last thing we're going to check are we're going to look at your nails and your nail beds. So as you know, your nail and your nail bed should be smooth and they should be pink. So I'm going to look at that. That looks good. Same on this. I'm going to check capillary refill at the same time. So I'm going to press the edge of her fingernail until it goes white. And it should, within 30 seconds, go back to the same color. Mind if I do the other hand?
Within 30 seconds?
Yeah, within 30 seconds.
Okay.
Okay. And if it doesn't go back, then it could indicate poor circulation.
Okay.
Mrs. Lewis, we are going to end this assessment by talking about risk factors and relevant teaching that we should provide you.
Okay.
Since you said you are sometimes exposed to sun and you do not wear sunscreen, I do encourage you to wear at least SPF 30. Skin cancer is originated from sunburns, especially severe sunburns, which you have reported having. So make sure whenever you go in the sun, get a moisturizer that has at least an SPF 50, and if you're going to be out for a couple hours, put sunscreen on your body.
Okay.
Another factor is that you're going to want to drink a lot of water. I know you said you're dehydrated a lot, but it's not good for your skin health. Another important thing is the use of lotions. Dry skin is very easily cracked. It can cause lesions on your skin, and that can cause bacteria to come in. That is not something you want, and it can just cause a whole lot of systemic diseases that can circulate throughout your body. Do you use tanning beds or any kind of ultraviolet light?
I do.
Okay. So I'm going to say you should stay away from the tanning beds. Ultraviolet light and the tanning beds have both proven to be risks for cancer. So either limit your time appropriately or go outside, but still be careful because you can get burned in the tanning bed.
Okay.
And finally, there's an assessment tool you can use, and it's called the ABCDEFG. Very easy to remember. It's the first part of the alphabet. And it's going to help when you check any lesions or moles that might appear on your body.
Okay.
So the A stands for symmetry. You're going to want to look and see if one side is comparable to the other side. B stands for irregular border. You want to assess if it's jagged or if it's any kind of blurred border. If you have just a regular mole, it should be symmetric and it should just be like a good circle. You shouldn't have any kind of unsymmetry that's going on.
Okay.
C stands for a change in color. So especially if the mole becomes black or blue.
Okay.
That is not good, and you should come to the either emergency room or your primary care doctor. D stands for the symmetry of the mole. F stands for if it's firm or if you can move it.
Okay.
G stands for growing progressively over a couple of weeks. And the E can stand for either evolving or the elevation of the mole.
Okay.
Okay? I think that's everything we wanted to talk to you about today. Thank you for coming in.
No problem.
Okay. That's the end of assessment.